Another organization is looking out for the health of pregnant women, specifically women of color. As Cronkite News reporter Roxanne De La Rosa found out, a new survey says that women of color are likely to experience mistreatment during their pregnancies.
Lakeisha Muhammad gave birth to her daughter more than 15 years ago. She says she was told by her doctor that her baby girl was in a breech position.
There are ways and there's techniques to deliver breech babies. None of that was offered to me. I was told that she would be a C-section because she was breech.
Muhammad says she felt groggy and sedated from her C-section.
But to not receive any sort of communication and understand where my hours-old newborn was for that period of time was actually quite traumatic for me.
In Arizona, more than 34% of Black women deliver via cesarean, more than any other race, according to the March of Dimes. Muhammad's birth experience set her on a journey to become a midwife who teaches mothers to advocate for themselves. She sees the disparities in treatment in her line of work.
That would come as no surprise to those of us who are doing birth work here in this nation and also here in Arizona. It is what we witness when we are in birthing rooms, when we are supporting families.
Erica Glaze is a certified lactation consultant and is expecting her second child. She remembers how she was treated while pregnant with her first child.
I had a nurse come in who was getting ready to administer like a medication. She's like, "Oh, I thought you were my high school patient, my 17-year-old high school patient down the hall." And I'm like, "No, like you should look at my chart." And then she also made a comment about me going to WIC and getting a pump.
Now she supports and educates breastfeeding mothers. Glaze says there's a lack of representation in the field of birth workers.
This is why we do this work. This is why BIPOC birth workers are here, because we know that mistreatment is happening. Mistreatment, when we heard that it's sometimes physical and sometimes it's a lot verbal too. It's what providers say, it's how they say it.
According to a survey by the National Institute for Healthcare Management, 40% of women of color experience mistreatment and discrimination while pregnant. Both Muhammad and Glaze primarily work with women of color. Muhammad says she builds relationships with her patients.
We are in a state of emergency. We have women who are dying. We have babies who are dying. Everyone should be talking about this.
In Tempe, Roxanne De La Rosa, Cronkite News.